Well, I'm Patty Hayes, and I am currently the chair of the Washington State Board of Health, which is a governor-appointed position. I'm the former director of Public Health Seattle-King County and also have spent time at the state level and federal level. Oh, absolutely. It's so clear to me. I was working doing home visiting, but as part of that, I was assigned to the trauma center to do assessments for individuals who were in the head injury unit. Almost all of them were young men who had motorcycle accidents. And as I was working with them, if they could, or with their families facing a devastating future, it was very clear to me that it was a preventable issue. And this was before the helmet law in the state of Washington. And it got my passion going for injury prevention and policy. And that was a really turning point in my career that led me both into public health, but also into being a lobbyist and working in all sorts of areas of public health. There are so many moments in my career that shape how I lead today. And I think that it's because I took opportunities to watch great leaders and learn from great leaders and be mentored by people. One of the defining moments as in my younger career when I was a lobbyist working in the state of Washington was we literally stood in the lobby to talk to legislators, and you had to be ready to interact with that legislator in any way, shape, or form as they were coming out of the doorway. Whether or not they were angry because of a vote that just happened, whether or not you were wasting their time, or whether or not they were excited to tell you what was going on. And it really honed my skills to be present in the moment. And as a nurse, of course, doing deep listening and being present during conversations was natural because of my education, but it really honed it and refined it. Yeah, well, that is a reality to almost all policy, and I've worked with a lot of students and policymakers on the issue. I think one of the challenges is that as folks new in advocacy and policy, when they have an issue they care a lot about, they feel like they know what the right answer is, but the reality of how to get to that final destination is could be a very long process. So I'll give you two examples. The one is an example of a short process. When airbags came out and there was a problem with putting children and infants in the front seat, it was one of the fastest adaptations of new policy of putting children in the back seat. It happened in 1 year, but it was because of death of children. I mean, it was so clear. That's a great instance that things can move fast. On the other hand, the Indoor Air Act in the state of Washington took over 40 years. And it was extremely incremental. And it had to go many, many years until we were able to show the problem with indirect exposure to smoking. Now we have a wonderful Indoor Air Act in the state of Washington and all over our country, actually. I think that one of the primary things that public health often gets wrong is that we believe that if we throw data at something, it will convince people. It's great to have data, but I think one of the strengths being a nurse in public health is I always start with client stories. And if I know I'm meeting with a legislator who is from a district who I know has a family with a story, I'll bring that family with me, or I will get permission to use or create a story so that it will resonate with the person. And then I bring the data in to show them the magnitude of the problem. So that's a matter of just public health realizing and being trained in advocacy and how you have to have the set of skills to enter into that space and really be present with the other person and starting with what their interest is, where they come from, and the stories that will really back up your data rather than data backing up just the policy. Well, I'm hopeful every day. As the chair of the State Board of Health, we are working on just critical issues. So there are these places where things come together. And even in times right now that look very bleak, we can move policy forward. There are policies we can't move forward, and you have to be ready to deal with that as well. But oftentimes, I think that public health right now gets on the defensive, and we really need to find a way to focus on the things that are working, move things forward, build relationships within that context so that we can then pivot and move back to these other critical areas that are really tough right now. So one of the highlights of my career was the development and implementation of Best Starts for Kids in King County, which started out as an interest area of the county executive because of the research that showed that if you invest in prevention when the children are very small and families are coming together, that the benefit lasts for so long. It's a life course approach. And we were able to not only develop a new model in King County, we were able to pass a major initiative that brought in millions and millions of dollars to help families in King County. I think one of the highest level skills an advocate needs is the ability to listen and take a deep breath. You've got to listen deeply. You've got to stop yourself and not just answer whatever question comes your way. You've got to think about the context and communicate back. But it really all starts with really listening to the person and being willing to be quiet enough to enter into the conversation at the right point. What I want to do a shout out to is Dr. Mikhail Keku, who is an astrophysicist, which can scare people off. But he's written a very interesting book just about 3 years ago called Quantum Supremacy. And it is like a futurist look at what's going to happen in healthcare, in technology, with the emergence of quantum computers. When you get quantum computing stabilized so that it actually can really refocus how fast we can analyze data, so many possibilities open up in policymaking. So I would recommend that book to anybody, and there's no math in it, so people don't have to be afraid that he's an astrophysicist.